Today is Thursday, September 26, 2023. I'm Steve Shields, president of the Royal Asiatic Society, Korea. Thank you for joining us. I express RAS Korea's sincere gratitude to the Asia Development Foundation for their continued financial support. You are cordially reminded that lecture content does not necessarily reflect the opinions or positions of the Royal Asiatic Society, Korea. Tonight, we are joined by Dr. Ali Seo. She is currently professor in the Department of Psychology at Sungshin Women's University here in Seoul. Her research has focused on clinical work in helping individuals sleep without medication. She works with specific populations, including PTSD patients, shift workers, mothers caring for infants who won't sleep. And her secondary research interest has included incorporating digital technology into sleep research, such as wearables, auto-videosomnography. Have I got that? Okay, yeah. Other digital apps. I have an app that monitors my sleep, and it's good, bad, good, bad, 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 good, good, bad, bad, good, bad, good, bad, good, bad, like that for 9 hours. So I get that. And that's after I take drugs. So sleep medications. Dr. Seo graduated from, in English, we call it Korea University, Kode, a bachelor's degree in psychology, got her doctorate in clinical psychology at Ohio State. Woo. She was trained as a psychological resident at Rush University Medical Center in Chicago and completed a postdoctoral fellowship at Stanford University Medical School. So let's give Dr. Seo a warm welcome. Thank you for being here. And clip that onto your hi somehow.
Am I good?
I think you're good.
Hi, everyone. I really apologize for the delay. Honestly, this is my first time ever being late for a talk, and I am so mortified right now. But hopefully the talk will make up for it. So as Stephen said, I'm a sleep psychologist. I work a lot with people who have sleep issues. And today I really wanted to focus a little bit. I understand that this society is really focused on kind of being more interested in Korean culture, and, you know, kind of based on all the sleep research that I've been doing. I wanted to talk a little bit about how my sleep research ties in with some sleep problems that we commonly see in Korea as well. Am I? Okay, let me see if I can get this to. Okay, can we start at the beginning? Okay, great. Is this can I go to the first? Okay, that's fine. So see if I can get this to work. Nope. No, it doesn't look like it's working. Okay, so maybe I'll just give you some hand signals. Yeah. So there's a couple things I wanted to talk about today. You're going to have to keep clicking. You know, we live in a society where we don't really value sleep. I don't know how many hours you guys sleep, but kind of thinking how late you are here today, I'm thinking not that much. Do any of you know who this guy is right here? I can give you a hint. He invented the light bulb. Edison. Yes. So so someone asked him, you know, about sleep, and Thomas Edison was, we call an enemy of sleep. He really discouraged people from sleeping. And one of the things that he used to say is sleep is a criminal waste of time and a heritage from our cave days. And I'm sure you know who this next person is. Someone asked Napoleon how many hours people should sleep. And he said 6 for a man, 7 for a woman, 8 for a fool. And in Korea, there's a really old proverb. You know, I spend most of my youth in Korea, and you know, this is a very common thing that you would see. You know, people would all the students would just sleep during the day, and there's this saying that says if you sleep 4 hours and you get in, sleeping 4 hours will get you into college, but if you sleep 5, you don't. So we really live in a society where we don't value sleep. And this talk kind of has two purposes. So one, I want you to understand a little bit about how sleep kind of ties in with some of Korea's current problems. But also I want to talk a little bit about, I want you to kind of rethink your relationship with sleep and think about what your values with sleep are as well. So those are the two purposes of today. And when you go to school in Korea, you usually have these like signs on the front of the class. And for those of you who can't read it, this one says, if you study for 10 more minutes, your wife's face becomes different. Or this one says, if you study 30 more minutes, your husband's job becomes different. This one says, do you want to go to college or do you want to go to a factory and sew? This one says, if you drool today, sleeping, tomorrow that will be your tears. So, you could see there, we really just, we're constantly reminded that, we really have to be competitive. We have to kind of reduce sleep, and sleep is not really valued in our society. So think about the time that you spend sleeping in your life. We spend about 1/3 of our life sleeping. And if you live about 100 years, that means you sleep about 32 years. And if you kind of look at how much people sleep across the world, you can kind of see that the landscape looks completely different. So for more Western countries, I want you to focus on how the proportion of how many people sleep less than 6 hours for each country. So you can see countries like Japan and Korea, almost half of the people sleep less than 6 hours, whereas places like Australia and New Zealand, most of the people are getting at least 7 hours of sleep. So there's a very different kind of landscape there. And, one of the things that we also see is the nightlife. I'm sure if you lived in Korea, you've noticed that, things are open super late. People, there's a place to go if you can't sleep. And it was really interesting. There was this one survey that was done that kind of looked at the proportion of how many night owls there are. And most of these countries are actually from Asia. These are the top 10. So you can see we kind of live in a culture where, we constantly have to be productive. We have to be competitive, and at the cost of what? At the cost of our sleep. Next. So, there was this one interesting study that kind of looked at Korea's youth. They track people, they tracked adolescents, and there was this one guideline that Canada put forth, and they asked they recommended that 3 things, that these children and youth get at least 60 minutes of moderate to vigorous physical activity, no more than 2 hours of recreational screen time, and 9 to 11 hours of sleep for those aged 5 to 13 years, and 8 to 10 hours for those aged 14 to 17 years. And what this study found was that very few of these adolescents actually met these criteria. So they weren't getting a lot of physical activity. They were doing quite a lot of screen time, and this was recreational screen time. And also, they weren't, only about 10% of these people were actually getting enough sleep. And if you kind of take all these 3 behaviors, which are kind of the pillars of health and happiness, only about 0.5% of individuals were actually meeting the criteria for this. So really, are we really living in a happy society is the question. Next. And, I'm sure if you've lived in Korea, you've kind of caught wind of the fact that we are not really doing well. We are kind of in the middle of a mental health crisis. This was an article in The Guardian this current year, but, more than 40 South Koreans kill themselves every day. Just keep on clicking. Yeah. And, every 34 minutes, I think this has actually reduced to every 30 minutes, someone completes suicide, and 3.2% attempt suicide. It is ranked number 1 among suicide rate in all of the OECD countries. It has increased exponentially in the past 10 years. And, even if people actually don't follow through with the behavior, a majority of people, if you ask them, they say that they've thought about killing themselves at some point in their life. So, these are some issues that we want to think about. And, sleep kind of really ties into this. Research has shown that not getting enough sleep is a very strong and independent risk factor for suicide. And this study here shows that the y-axis is suicide rate, and the x-axis is 4 groups that actually show the different rates of suicide in these 4 groups. And it shows that insomnia is a independent predictor of suicide, regardless of whether you have mental health problems or not. Usually, for individuals who complete or try to attempt suicide, what happens is that they usually have some type of sleep problems before they actually commit suicide. Next. So I wanted to give you a little background about sleep. I know that probably you haven't had a lot of opportunities to kind of learn more about sleep, and hopefully you'll learn a little bit about your own sleep as well. So the best formula for optimal sleep, there's some good science, strong science behind sleep. It's like when you're trying to lose weight, you have to move more and eat less in order to lose weight. There's kind of a similar science to that. And, a lot of people, when they're not sleeping, they think that they have to compensate for sleep, but just doing it in any kind of disorganized way usually won't work. So the first principle of sleep is that you need to be awake for a long time. So once you're awake, what happens is you start building up sleep pressure. It's kind of like you're building up an appetite for sleep, and the longer you're awake, the more likely you are to sleep. The second one is sleep timing. So everyone has an internal circadian rhythm, which means that you just can't sleep at any time. There's an optimal time, which is usually around 10 p.m. to 12 p.m. for most people. If you're an evening person, it's usually a little later. If you're a morning person, it's usually a little earlier. But there's an optimal time for you to sleep. So even if you've pulled an all-nighter, you can't just sleep at any time during the day. Like, I'm sure you're tired and you've tried to lay down for a nap and you find yourself not being able to sleep. It's because your circadian rhythm is preventing you from doing that. And the third condition that you need to get optimal sleep is something called low arousal. So if your body feels threatened in any way, then what's going to happen is it's going to completely inhibit your sleep system. So when I say threatened, this can be in any type of mental or physical stress. So, it can be any type of change, like starting a family or having a child. It could also mean like death of a loved one. It could mean any type of those things. And your body doesn't know whether it's some type of threat to your survival or some type of mental stress. So what we really need to know is that you have to feel peaceful inside in order to sleep. So in summary, having all these 3 conditions aligned is very important for getting good sleep. And, there's a lot of reasons why we do sleep. These are all some good reasons that have found why sleep is important. Next. So these are all just some really good studies that have shown. So for example, this shows that when you were sleeping, your growth hormone, your brain secretes growth hormone so that, when you're growing up, you can make sure that you're developing properly. And also there's been really good studies that have shown that, I'm sure if you haven't slept, you notice that you can't focus very well, you can't concentrate, you can't remember things as you used to. These are just some good examples that show that, when you don't sleep, what happens is there's this rubbish that kind of builds up and accumulates in your brain. And when you don't sleep, what happens is that rubbish doesn't get cleaned out. And what happens is it could lead to some things like dementia. Next. Okay, it might work now. Oh, okay, great. And another reason why we sleep is to stay awake. So if you actually come visit our sleep lab, we do a test called the psychomotor vigilance test. There's a black screen and a red square, and at any time there's a number that kind of pops out. And whenever the number pops out, as fast as possible, you have to touch the screen. What we find is that individuals who don't sleep very well, actually touch the screen really late than normal, or even when there's no numbers, they might touch the screen, or they might miss the numbers, because if you don't sleep, what happens is you kind of get into this state of micro sleep, which means that you kind of like doze off for 1 second. And when that happens, it might not seem like a big deal, but it could lead to accidents where, you have drowsing and you get into a really big accident. So, kind of in summary, you can kind of see that it is really important for us to, for everyone to sleep well. And another really important reason why you should sleep well is that loss of sleep definitely can cause some type of psychiatric disorders. This was a really important study that that compared people, 4,000 individuals, 1 year before and 1 year later, and individuals who actually had insomnia and didn't sleep very well were much more likely to develop all these types of different psychiatric disorders, mainly depression or anxiety. And another interesting thing is that if you become depressed, not only does not sleeping well cause depression, but depression also causes bad sleep. And so this is something called sleep architecture. So sleep is divided into 4 stages: stage one, stage 2, stage 3, and 4, and REM sleep. And the top part here is a normal sleeper, and the bottom part here is someone who's depressed. And as you can see, there's a lot more jagged lines, which actually means that they're awake a lot more often. The REM sleep, which is this kind of, this kind of black part here, this is the time where you dream. So this x-axis is time. And as you can see, it's much more unstable, and there's a lot more time spent awake. So what we find is that not only does not sleeping well make you depressed, depression can also cause you to not sleep very well. And what we've actually found is that, this was one of the studies that I did when I was at Stanford, is that insomnia treatment actually does help improve depression. And even if you don't do any type of mental health therapy or anything like that, what we find is that it does help people kind of reduce their suicidal ideation. So what we've been doing is, really kind of trying to promote the sleep research, promote getting better sleep in order to kind of prevent these mental health problems, because we do know that it is kind of a big problem in Korea. So there was this really great sleep researcher that I liked, and I wanted to kind of share a study that he did. And this was the guy who was famous back in the 70s, but he was really curious what would happen if people didn't sleep at all. Like if you deprive someone of total sleep, if you totally deprive people of sleep, what would happen? And so he couldn't do this with humans because of course it's unethical. And so what he did was he did it with mice, and you could see they have a little electrode in their brain, which kind of determines whether the mouse is asleep or not. He gave them ample food and water, put them on a disc, and whenever the mice would start to sleep, he would dunk them into the bucket. And so these mice didn't get any sleep at all. So what do you think would happen? What do you think happened to all the mice? Yeah, exactly. So all the mice died within 15 to 30 days, and they stopped feeding. They became like, they shed all their fur. They became like really, they became really weak. They decided not to move. And so he left us with this quote: "If sleep doesn't serve an absolutely vital function, it is the greatest mistake evolution has ever made." So, I hope that this kind of convinced you that sleep is important. And kind of with that segue, I wanted to kind of start talking a little bit about my research that I do. And I'm sure this term is maybe a little bit new to you: revenge bedtime procrastination. Who's heard of it before? No one? Okay. So it kind of ties in with this notion, I don't know if any of you are raising children or teenagers, but over the last 10 years, a lot of us have started to get cell phones. And with cell phones, what happens is that we start using them more and more in bed. And this has become kind of a problem for getting adequate sleep. So I wanted to ask you, do any of you ever do this? You kind of lie in bed, you plug your phone in to make sure that the juice doesn't run out. You kind of lie in bed and you scroll and scroll until you feel like you can fall asleep. I see a couple of you nodding, but this is the behavior of what we call bedtime procrastination. And the way that it's defined is that you're going to bed later than intended. You know that you're going to suffer the next day. You know tomorrow's going to suck because you didn't get enough sleep, but you still do it anyways. And you usually do it, you're doing it voluntarily. It's not like you have a deadline, or it's not like you have children to tend to. You're doing it without any type of having external reasons to do so. And this behavior has become so prevalent in the past 5 to 10 years because we all started to get smart devices. And before then, people would maybe watch TV before bed. But now that everyone has their own devices, it's much more easier to actually lie in bed, scroll, and delay your bedtime. So we did this study. I know this is a little bit of a busy slide, and I can see that you can't see it very well, but what we did was we asked 105 young adults to kind of participate in the study. And this is something called a tempogram. So this is the x-axis is time. And this, the right end part is when the person goes to bed. So this is 3 hours before a person goes to bed. We asked them to log what they did every 10 minutes. So like, what are you doing every 10 minutes, 3 hours before bed? And we divided the groups into people who had low bedtime procrastination and high bedtime procrastination. And kind of visually, I'm sure you could see that this kind of peach colored area is vastly different. And what that means is that, I don't know if you could read this, but it says leisure activity using media. So what that means is that individuals who were engaging in high bedtime procrastination actually were using a lot more media 3 hours before bed. And we were wondering, like, well, so how much more are they actually using it? And what we found was that individuals who were in the high bedtime procrastination group actually were spending 61 more minutes compared to the low bedtime procrastination group on their smartphone compared to the low bedtime procrastination group. So what that means is that, they were spending at least 7 hours more per week in bed on their cell phones, which is actually a really, it's a big number. If you think about how competitive Korea is, why are they spending so much time? And so what we did was we were actually really curious, so why are they doing this? What is the function? What are they getting out of scrolling so much before bedtime? And so there was this neat categorization scheme that we kind of picked up on, and we asked these people, we kind of used their metadata on their phone and kind of wanted to see what they were actually doing on their phone 3 hours before bed. And you can see this is something called a heat map. And the darker areas are the more significant ones. And you could see that communication and leisure were actually the most widely used activities that individuals were doing on their cell phone before bed. And what we also found was that the main culprit was YouTube. I'm sure you probably knew that before I said it, but it was YouTube. And the other two were a KakaoTalk, which is a messenger service in Korea, and being on the telephone. So these were the three things. And we really wanted to take a look at what they were doing, because it would kind of provide some type of clue in terms of what need it was fulfilling for these individuals. So in psychology, we have this kind of assessment tool that's called functional analysis. And what we do, I think that's the wrong one. What we do is we ask them to kind of think about what they do right before bed, right before scrolling on their phones, and what they get out of it afterwards. And what we found was that individuals who were scrolling a lot on their phone and engaging in a lot of bedtime procrastination behavior kind of reported that they were coping with more loneliness at night. This is a time of COVID, so they weren't feeling like they weren't getting enough social interaction. They were really anxious or depressed right before bed, and they wanted to kind of get rid of those emotions. And they were using the YouTubes to kind of distract themselves. They were using it as entertainment. And if you use bedtime procrastination as a reward, which is called revenge bedtime procrastination. So if you kind of feel that you've worked so hard during the day that you deserve some type of time to yourself, that was also another thing. Or like sometimes you just don't want to wash your face. It's just so daunting to have to go and wash your face and shower before bedtime. So avoiding some type of aversive bedtime routine. or even avoiding thinking about tomorrow. And what we find is that the reasons why people can't scroll, there were top 3 answers of why people couldn't stop scrolling at bedtime. And the first one was emotion regulation. What that means is that usually right before bed, a lot of people start to have negative thoughts. These are thoughts that probably won't come up during the day because you're just so busy and going about your day. But then, right before bed, you start to worry about what's going to happen tomorrow. You might overthink about what someone said during the day. And when you have these emotions, it's really hard to get into a good space where you could sleep. And so these people were trying to use their cell phones to try to kind of make themselves feel a little bit better. The second one was compensation. This one is about this is the revenge bedtime procrastination, but feeling like they deserve a reward for the day. I worked so hard today, I did all this stuff, and I want to kind of reward myself. And the third one was social interaction. And I'm going to talk a little bit more about loneliness in a little bit because it is kind of one of the main problems that have really been coming up in Korea. But in the era of COVID, a lot of people don't really lack that social intimacy and social connection. And so what they do is that right before bed, they try to reach out. They might go on a social network service and try to reach out and connect with people. They might want to try to talk to someone that they like, and the conversation might get too long. But these were the main 3 reasons why people we're engaging in bedtime procrastination. And when last year our study got picked up by the Wall Street Journal, and I really liked the way the journalist kind of framed it, and I'm going to read it to you. She said that revenge refers to delaying sleep to retaliate against your busy life, reasserting control over your time during the few hours when you can. So although of course the person who ultimately suffers is you. So we live in a society where things are really competitive, and people kind of reduce their sleep time for it, but at what cost? They still need this time to decompress. They still need this time to kind of de-stress and have leisure, and they're doing it at the cost of sleep. So it really says a little bit about where we are as a society. And I wanted to talk a little bit about sleep and social relationships as well. Are these talks usually interactive or not?
It can be.
It can be. If any of you have any questions, feel free to raise your hand. And okay, sure. Sure, feel free to ask questions. Sorry, I'm really used to college students asking a lot of questions. So it's a little strange that everyone's silent. Okay. So one of the really interesting things is that sleep has been considered more of like an intrapersonal process. Like it's something that you do alone. It's not something that you share with something else, but that's actually not true. A lot of people do sleep with someone, and usually sleep does also affect your social relationships. One of the main research lines that have come out of this is kind of looking at sleep and the marital relationship. And when we did a study in Korea that actually showed this, we looked at people in Ansan. And what we found was when we followed people 4 years afterwards, what we found was that sleep quality predicted marital satisfaction. So the better sleep that people got, the more satisfied they were with their marriage. But also it was the same vice versa. Also, if you were a little older, marital satisfaction also predicted sleep quality. So, the person sleeping next to you, if they make you feel peaceful and they make you feel kind of at home, you're more likely to get better sleep. I mean, if any of you are married, I don't know if you've had had the experience where you fight with your spouse and then you really don't want to sleep next to them. If that's happened, you kind of understand this mechanism. Did you have a question? That's true. That's very astute observation. So we only found this to be true in individuals over 55. However, I do have to say that this was a little bit of an older cohort, an older sample. So we only had people who were older than 45. So it didn't really mean much that we found this relationship. And I am going to talk a little bit about alcohol in a little bit. So I will remember that question. Yes.
Right.
Sure.
So you're saying that if you're married and sleep with your partner, it's better than not sleeping with them?
No, it means if you have a good relationship with if you have a good relationship with your partner, it actually will guarantee that you will get better sleep.
Okay,
and
even if you don't sleep together.
even if you don't sleep together. And even if you have if you sleep well, that also ensures that your relationship will be better. It kind of goes both ways. Mhm. And I wanted to talk a little bit about, sex as well. I'm sure, so I know the two concepts don't usually get talked together in a lot of contexts, but what we found was that, after a night when women had really terrible sleep, most women say they kind of felt less sexual desire and less sexual activity. And this is also the case for men. I don't know if this will this will be the convincing point that will get you to sleep better, but men who were restricted to 5 hours of sleep for 8 consecutive nights actually had a 10 to 15% reduction in testosterone levels, which is the equivalent of aging 10 to 15 years. That's a lot. So, and also testosterone is really tied with sexual desire. So if you're in a relationship, this not getting enough sleep is definitely going to also affect your sexual life as well. And also we found that it also has to do with testicular volume. So the less you sleep, the less testicular volume you have, and that is actually very highly correlated with how much sperm count you have. So if you're trying to reproduce, that's also can be an issue. And so there's been a lot of these studies, and I think this kind of study really ties it together. It is a little bit busy, and I'm not going to talk about the study too much in detail. But what this study found was that sleep loss actually causes people to withdraw socially and feel more lonely. So what they did was they deprived people. They had 2 groups, and they deprived half of the people, and they didn't sleep deprive the other half. And what they found was that individuals who were sleep deprived actually did not prefer to be in close contact with other people. They were like, if you were at a party, that means like you kind of prefer to isolate yourself and go stand in a corner. And usually if you're more sleep deprived, it kind of really heightened your sense of loneliness as well. And loneliness is really kind of a big issue that has been discussed worldwide. It's actually been shown to be worse than smoking for your health, or even worse than drinking alcohol. And loneliness has been really one of the main mental health issues that really a lot of governments have been interested in. So sleep loss is really associated with that. And I wanted to talk a little bit about kind of how this ties in with some of the issues we have in Korea society. I don't know if you've seen this bear cafe, paw cafe. So this started in Japan, and I thought it was really crazy, to be honest. So there's a cafe, you go in and there's no one there. You don't interact with anyone, and that's the whole point. There's a hole in the wall. You can order something, I think with a computer, and what happens is there's a bear paw that comes out with your drink, and you don't interact with anyone. You just get your drink and you drink it. So the whole concept is that, if you really want to be alone and don't really want to avoid interacting with other people, this is the place to go. And when I first read about this, I was like, that's really crazy. Why would anyone go here? But actually they brought this cafe over to Korea, and it's been doing really well. So it's interesting, how not only is society very lonely, but a lot of people are intentionally isolating themselves as well. And I don't know if you've been following the news, but the President Yoon's administration has really been very focused on the problem of extreme social withdrawal in adults. So in 2021, the Ministry of Welfare reported that depression rates are really the highest among all the age groups, individuals in their 20s to 30s. And what they found was that they have this group of kind of young adults in their 20s and 30s that have really fallen through the cracks. They're not employed. They don't go to school. They just stay at home all day. They don't do anything. And reports show that a lot of these individuals actually aren't employed, and they don't meet anyone. It's not like they're just hanging out and hanging out with their friends. And what that they found is when they named this extreme social withdrawal group, and it's actually quite a large number of people. It's about 4.5% of the population. And what they found is that they kind of lock themselves in the room. They are completely emotionally and physically isolated from the world, meaning more than 6 months. They don't have any type of economic activity. They don't seek jobs. They're not in type of any educational training at all. They usually live alone for 6 months or longer. And this has actually been quite a problem. These are people who should be in the workforce. These are people who should be engaging socially if they're not working. And these are people who've kind of deliberately decided to isolate themselves. And what we found was that there's actually a lot of reasons why, in Korean society that I think we can kind of get some good lessons from. Some of it is kind of more structural issues, like not having enough jobs. Some of them are interpersonal issues, like having been bullied during school and having some type of interpersonal trauma, being victims of domestic violence. And a lot of these are actually psychological factors as well, having some type of mental health issues, feeling like they've just done so much in their academic years that they just done, they don't want to do anything else, and they don't want to even, they're just completely burnt out. And so these are kind of, this is the landscape that we found of people who were engaging in social withdrawal. And a lot of them were completely depressed. And we kind of see this as, being very burnt out of kind of their academic years. I'm sure that some of you are very familiar with how competitive Korea is academically. And, they've worked so hard up until their high school years that they just don't want to deal with it anymore. And this concept of extreme social withdrawal Korea was not the first person to come up with this. This is actually a concept that was first introduced in Japan called hikikomori. I'm sure you've heard of it. It's characterized by social withdrawal, social isolation, prolonged, it's very extreme social withdrawal. And what they found is that extreme social withdrawal is actually kind of on the same spectrum as hikikomori. And what researchers have really started to propose is that we actually shouldn't call them hikikomori anymore. This is kind of not just a Japanese phenomenon. It's actually more of a global phenomenon. And I'm sure all of you, since you're here, you're probably not suffering from extreme social withdrawal. But there are quite a substantial subset of young people who seclude themselves for most of the time at home, no longer engage in education or work, and they just completely withdraw from society. And in Japan, this phenomenon is called labeled as hikikomori, but because globally there is actually an increase in these people, and with COVID, it's actually been really getting worse. So the correct term that we've started to use is extreme social withdrawal. And so kind of like thinking about how this is more of a developmental issue. These people, they go through these cycles of extreme social deprivation, sleep deprivation, and they have a lot of stress, and all of these things kind of end up where a lot of individuals just kind of drop out of society. So another line of research that I've been really interested in is kind of sleep and babies and the marital relationship. And so I wanted to talk a little bit about my research about this part. And another social issue that I wanted to bring up is the lowest fertility rate. This has been in the news a lot recently. I'm sure you know that in the whole world, having a fertility rate, I think of 0.7. And I recently heard that Seoul's birth rate was 0.5, which it has been completely unheard of, is ridiculous. And what research has found is that the reason why South Korea's birth rate is so low is partly because people don't want to get married, but also the other piece is that if you have a couple that gets married, to sustain the population, they need to have at least 2 children, right? But what's happening is that most people have 1 child, and then they just quit. They're like, no, I'm done. This is too hard. And so one of the professors in my university actually wanted to know why, these are people who already have the experience. They know that, having children is a joyful experience, but why do they decide to just be one and done? And what they found was that sleep deprivation was actually a pretty strong issue that was associated with not deciding to have another child. And this was kind of the quote from one of the participants. She was saying, experiencing sleep deprivation after the baby is born led to a sleep disorder. And not being able to kind of fulfill my most necessary needs felt like childcare was a punishment. And so we decided not to have another child. And so, kind of thinking about sleep in the context of low birth rate as well. And so this is one of the studies that we did. We kind of got together 10 mothers and we asked them to report what kind of sleep problems they had. And these were just some of the things that they said about themselves. There's some good ways to sleep train your child to get them to sleep better, but thinking that, being very judgmental about yourself, letting my baby scream and cry means I'm a terrible parent. I fed the baby anytime he felt sleepy because I think that the baby will sleep longer when he's full. I should be on call all night long just in case my child needs me. These were just some of the things that these mothers said. And usually what we find in children, these are more typical sleep problems, is, the child takes really long time to fall asleep, or they wake up in the middle of the night multiple times, but they can't go back to sleep by themselves without any type of parental intervention. Or they kind of have all these really elaborate curtain calls, like, I need another drink of water, I need to go to the bathroom, et cetera, and kind of delaying their bedtime. So these are 3 common sleep problems that parents do report. And what we find is that, while sleeping through the night is achieved by most infants during the first year, about 1/3 of infants actually don't achieve this. And these are all studies that have been done in the States and in Western cultures. And so we were really interested to see if there was really a difference culturally. So one of the things that we do need to keep in mind is that sleep is giving birth is actually kind of a stressful experience for a lot of mothers. So this is kind of something called the 3P model for insomnia, which I'm going to talk about it in a little bit. But when you don't have insomnia, usually you have some type of vulnerability factor that you're predisposed to. And what happens is any type of stress event or major change in your life can actually start to precipitate a sleep problem. And so as you can see here, getting pregnant or gaining a family member actually rates really high on the stress scale. This was 2 stress researchers that compiled all the stressful events that people could experience. And what they found was that it was actually ranked higher than death of a friend or bankruptcy, which is pretty high. And so, we want to really think about why, if the child doesn't sleep, usually the mother doesn't sleep, and it causes this perpetual vicious cycle. And mothers who have children with sleep problems report higher levels of postpartum depression, physical problems, more limitation in daily life, parental burnout, poor mental health, things like that. These are all the type of factors that we want to be interested in, psychological factors that will actually contribute to, women not deciding to have additional children. And so, the first thing we were really interested in kind of sleep arrangements. I don't know about most of you and how what kind of arrangements you had when you were younger, but what we found is that Korea was much more likely to co-sleep with their child. So what that means is that usually if you're in a Western country like Australia or United States, United Kingdoms, you usually have a child and they sleep in a completely separate room. There's a baby monitor. And, if the baby cries, the mom comes to the room. Whereas in Korea, everyone just sleeps in the same place. This could be due to space limitations, or it could be due to just the mom, just like the culture in and of itself. And I don't know if you've seen this movie, Minari, but I think one of the things that my friends in the States really told me was that this scene was so memorable. So for those who haven't seen the movie, I don't want to spoil it too much for you, but there's a big fire, and at the end, the 4 family members actually the 5 family members just kind of sleep together in the same room. And this is actually quite common in Korea, where know, all the family members just sleep together in a room. And, you know, at first when I heard this, I was like, well, maybe it's when the kids are younger. But then, you know, I asked how old these kids were, and they were like in 7th grade, 9th grade, and they were still sleeping with their parents. So it does happen quite later, but even when the kids are pretty grown up as well. And this is kind of a more stark comparison. This is a study that we did in our lab that was done in the States that kind of looked at room sharing across different cultures. And you could see that Korea, over half of the families did do room sharing. Everyone was kind of sleeping in the same room, and compared to all the other Western cultures. And what this means is that, you know, when you're sleeping with your child, your sleep also suffers too. And it's actually not really recommended by the American Academy of Sleep to actually sleep together in a room. So we were wondering, well, you know, there's really good ways to kind of separate rooms and try to get the child to sleep independently. So why aren't Korean families really implementing this? There's really good ways to sleep train your child so that the parent can get better sleep. So why aren't they using this? And one of the important things to remember is that when the child turns about 6 months, there's 2 really important developmental milestones that happen. The first is that the child obtains the physical ability to self-soothe, which means that if they wake up in the middle of the night, they can actually like suck their thumb or like rub their face and kind of coax themselves back to bed. And the second is that they have the ability to sleep through the night. So their brain develops enough so that they could sleep 5 to 6 hour stretches at a time. And so what this means is that at 6 months, the baby is ready to do something called sleep training, which means that the baby can actually go to sleep by himself, even if they're still awake. And the parent can provide minimal intervention, which means that the parent can just put the baby in the bed and then not worry about the baby until the next morning, because the baby has the physical ability to do so. But what we found is that most people in Korea were not doing this. And I just wanted to kind of briefly give you an idea of what sleep training is for those of you who don't know. There's 3 types of sleep training that are evidence-based and are recommended by the American Academy of Sleep. The first one is called a standard extinction. So basically, you put your child to bed, the baby cries bloody hell, and you just leave them there until the next morning. And the baby somehow, after 3 to 5 days, recognizes that the mom or the parent will not come, and they start to kind of learn that they can go to sleep by themselves. So this is kind of the more fastest method, but also the most coldest method. The second one is called graduated extinction, or is more likely known as the Ferber method by its inventor. And this one is where you're actually gradually increasing time intervening when the child cries. So the first day you might check in every 2 minutes. The second day you increase that to 3 minutes. And it's a more graduated method compared to the previous method, and it is recommended a little bit more for parents who have difficulty tolerating their children crying. The third method is called camping out. So you put the child to bed awake, but you stay in the room until the child falls asleep. And this is actually, it takes the longest out of all the methods, but it's actually best for parents and children who are more anxious. So these are the 3 methods that all Western parents kind of take into consideration when they have a child and implement. And what research found, what we found in our lab is that the implementation of sleep training was really, really low compared to other Western cultures. So we found that not a lot of parents knew about it to start off with. A little over half of them had heard of sleep training, and only about one in 4 parents actually implemented it. And this was, if you compare this to kind of the Western cultures, you could see that it's actually only about half of that. And so, you know, we have this culture where, you know, Korean parents are sleeping with their child in the same room until they have pubic hair, and they're still, you know, their sleep is still suffering, and it's causing them a lot of stress, but it's not really changing. So, yeah, sure.
Have you done comparisons with other Asian
countries? So there was, we haven't done direct comparisons, but there have been studies that have been done, and it's actually more prevalent in Asian countries. So the rates are pretty similar. And even if you go to like a place like Australia, if you look at racial differences, like Asian versus Caucasians, you do see a little bit more difference with co-sleeping. So it is definitely like a cultural thing that goes on, but you know, at what cost? Did you have a question? Yes, sir. Pardon? Oh, that's behavioral sleep intervention. Sorry. It's what we call sleep training is a professional word. Yes?
So sleeping with children is sort of prevalent across Asia, not just Korea.
Yes, yes. So it is more of a common Asian culture that we find also in different Western cultures with Asian subcultures. But also research has found that if you co-sleep, that it does make the parents' insomnia worse, their sleep quality does suffer. And usually what happens is that the child doesn't really develop the ability to self-soothe by themselves, which is a very important self-regulation skill. And so that's also another kind of thing. So, you know, I get these, I see patients and I get these parents who come to me and they have these 3-year-olds and they say they've never slept for more than three-hour stretches at a time, which for a 3-year-old is pretty terrible. And so, you know, you want to think about, you know, what kind of impact does that have on the parent? And if I was a parent whose child who hasn't slept in more than 3-hour stretches for over 3 years, you know, I definitely would not want to have another child myself as well, you know, so it really it makes me think about the implications of that. And also another interesting thing that we actually haven't published this and we're kind of expecting a little bit of an outrage about it. But what we did was we also researched partner involvement in nighttime care. So nighttime childcare is like, you know, bathing the child and getting them ready to go to sleep and putting them to sleep. And what we found was that, you know, a lot of fathers don't really engage or participate in nighttime childcare as well. And I think this really comes from the culture of, you know, Confucianism, where, you know, men are not really participating in domestic chores, but, you know, times are changing. And unfortunately, research shows that 43.1% of mothers reported being solely responsible for nighttime childcare, which is really low. And when you think about that, so I'm not going to talk too much about this study, but I just want you to kind of follow the arrows. So the less partner involvement in nighttime childcare, it did have an effect on their marital adjustments. So the satisfaction with the marriage went down. And also the less involved the partner was, the more the mom had severe insomnia. And also what we found was that the child took longer to fall asleep. So SOL is sleep onset latency, which means it takes longer. It takes longer to, does it mean something else? Oh, hopefully not a bad word. Huh? So it means it takes them longer to fall asleep, and wake after sleep onset means it takes the longer time that they have that they're spending awake in the middle of the night. So as you can see, kind of the way that the partner is involved in night care did have kind of a significant impact in other areas of their child's life. So did anyone have any questions until now? I just wanted to, while I was closing out my talk, I wanted to kind of leave you with some tips to improve your sleep for those of you who take medication. So I don't know if you have these experiences where you lie in bed and you think about these things. You might say to yourself, the longer I stay in bed, the higher chance I will have about falling asleep. I'm going to work out so hard that I pass out. I didn't sleep well yesterday, so I'm going to go to bed early today. I'm going to drink a beer. Someone asked about alcohol earlier. I'm going to drink a beer and try to fall asleep. I pulled an all-nighter yesterday, so I'm going to take a really long nap today. These are all some things that people say. Oh, am I out of time? No, I'm good? Okay. Okay, so first of all, I want you to kind of do a quick checklist to see if you're a good sleeper. And the clinical criteria, diagnostic criteria for insomnia is that if you lie in bed intending to go to sleep and it takes you more than 30 minutes to go to sleep, then that is considered insomnia. Or if you wake up often in the middle of the night, So let's say you did fall asleep, but you woke up in the middle of the night and it takes you longer than 30 minutes to fall back asleep. Or if you wake up earlier than you planned and you can't get back to sleep, let's say you planned on waking up at 7, but you woke up at 4 and then you can't sleep for the rest of the night. Those three symptoms is what we indicate as insomnia symptoms. And when those symptoms have consequences during the day, so for example, you feel sleepy during the day, it affects your quality of life, and other people around you can tell you're tired, you're dissatisfied with your sleep, you're worried about your sleep, and thinking about sleep stresses you out. You can't concentrate, you have memory problems, your mood is irritable. Kind of tally up how many are relevant to you. All 10 for you. Oh. So if you have more than 5, then there's a really good chance that you might have some type of sleep issue. So usually in the States, what we do is, there's kind of 2 really evidence-based treatment options. One is probably the more well-known route of taking sleep medications. The second is what I'm going to focus on a little bit more. So in the States and in a lot of different countries, usually, people don't like taking sleep medications. And so they like to kind of take a more non-pharmacological approach. And there's a treatment option called cognitive behavioral therapy for insomnia, which is a type of psychotherapy that can be done and is usually done with psychologists like I do. For those of you who are kind of curious about medication, so usually if you go and say, I can't sleep to a doctor, they'll give you this sleep medication. It's called Ambien in the States. I think in Korea, it's called something different. And there are some pros and cons about choosing whichever option. So if you do choose to take sleep medication, it will help you sleep immediately. So it does have really fast effects. But the main problem is that you build a tolerance toward it. So you have to keep on increasing your dosage to kind of establish the same effects, which can be problematic. And the main problem is once you stop taking sleep medication, it actually can make your sleep problems come back. Yes, sir. Did you have a question? It's a non-benzodiazepam, which means it's more of a it's kind of like an anxiolytic drug. It's called Zolpidem in I think that's like the generic name. But it just helps you knocks you out. Melatonin is completely different.
Not
Yeah.
good, or at least you hallucinate and go online and people have a friend who does that.
Yes, and eat weird things. Yes.
What is the difference between those?
So melatonin is a natural hormone that is secreted in your brain, and it is secreted naturally 3 hours before your bedtime. It can help you sleep, and I can talk a little bit about melatonin at the end, but this is actually it's a synthetic drug, and it actually helps kind of helps you sleep better. So melatonin doesn't help you sleep better. Yeah, it does increase your sleep quality, and it helps you regulate your sleep timing, but it doesn't actually help you. The effects doesn't help you sleep better, is what research has shown. But people prefer melatonin, I think, because it is more of a natural hormone. You naturally secrete it in your brain. Any other questions? So talking a little bit about cognitive behavioral therapy for insomnia, you meet with a professional trained in sleep medicine, meet about 4 to 6 times, and you're specifically talking about, some kind of bad habits that you have with your sleep. It's been endorsed by many organizations as the first line of treatment. So the main one recently was in 2016, where the American College of Physicians recommends that before you take sleep medication, you should try CBTI. So there's been some really good evidence that shows that for long-term effects, kind of taking a more non-pharmacological route is helpful.
Your picture a couple of slides ago said a paid pal.
Yes.
I thought that meant like a prostitute.
No. Well, there was the company called PayPal. So it's kind of like a therapist who's a paid pal, not a prostitute.
Well, I thought it meant somebody to sleep.
No. Okay. That's a good question. There's actually been some studies that have looked at that. I I don't think there's any conclusive evidence that they do disrupt your sleep, but I think it really depends on the animal. Like if you have a pretty docile pet, yeah, that's just my my preference of animals. I'm sorry if that was very confusing. Yes, I just like that he was acting like Freud. Okay. Any other questions?
So is there any place to get this cognitive
Yes.
therapy in Korea?
Well, I provide it in my own private practice. There are a couple of, if you prefer Korean, there are a couple of doctors who do it too. And there aren't a ton of providers, but there are people who do it, and I train a lot of. It is not covered. Yes. If you go to a hospital, it is covered. Yeah, it is covered, but not with private practice, unfortunately. And so I talked a little bit about this earlier, the 3P model of insomnia, where there's this arbitrary line, and if you go over it, the threshold, you can get insomnia. And usually before you have insomnia, you have these vulnerability factors. So if you're like a worrier, or if you're a night person but have to live like a morning person, those are all some vulnerability factors that can make you more vulnerable to insomnia or sleep problems. But those in and of itself don't give you insomnia. But if you've ever kind of lost sleep right before an important event, you probably have experienced short-term insomnia, which means that you have some type of stressful event that kind of sets off the insomnia. And everyone kind of experiences this at some point or the other. So we're not too worried about this. What we're really worried about is the chronic insomnia piece. So about 10% of people who have short-term insomnia actually get that kind of course becomes chronic. And even when the stressful event goes away, they kind of start to have these perpetuating factors, these factors that kind of maintain the insomnia. And what CBTI, or cognitive behavioral therapy for insomnia, is really trying to do is trying to really get rid of those perpetuating factors. So these are things like staying in bed awake without sleeping, scrolling on your phone, napping a lot during the day, trying too hard to sleep, drinking before bedtime alcohol, vigorous exercise before bedtime, or taking sleep medication different from prescribed amount or method. I heard a lot of Koreans do this. Okay, like, when I worked in a sleep clinic at Stanford, I would get these people who would rub it on their gums and, take like 10 pills when we only told them to take 1. So we do get those types of people. So all of these things are kind of compensatory behaviors that people use to try to get better sleep, but they're not productive. They don't actually help you sleep better. So these are some of the bad habits that we're really trying to get rid of. And one of the things that is important to remember is that sleep is a learned behavior, learned not in the term that you have to like learn it in school, but it's something that your body kind of learns. So if you think about it, from the moment that you're born, you have this physiological, natural sense of sleepiness, and it's really paired continuously with your bed. And so if you get a really good sleeper, what happens is they go to bed and they're like, oh, I'm not tired, but then they go to bed and they can kind of completely pass out. So these are really good sleepers. But what happens if you're not a good sleeper is that you lie in bed and you don't sleep. You do all these things. You worry, you think too much, you think about that one time in 6th grade that this person wronged you, or you think about these important things that you have to do tomorrow. And what happens is if you start to do these things in bed, your brain starts to think, well, I thought your bed was a place that you're sleeping, but I guess now your bed is a place of worrying and thinking about all these other things. And I guess your bed is not a place of sleep. And so we call this hyperarousal. This sense of hyperarousal in your bed gets repeatedly paired. And so the way that you know that someone is not a good sleeper is they'll say something like, oh, I was kind of like dozing off on my couch watching a movie, and so I decided to go to bed. But the moment I got into bed, I was completely wide awake and I just couldn't sleep at all. That's usually something that an insomniac would report. And so to give you an idea of how sleep is a learned behavior, I don't know if you could turn this on if you have internet. Okay, so as you can see, this child, everyone learns, you can turn it off, but everyone learns that you can sleep under certain conditions. And that's why sleep is a learned behavior. So this baby, unfortunately, has learned that it can only sleep in the kitchen sink, probably because he or she had desperate parents who were trying to get him or her to sleep and probably heard somewhere that white noise helped. And now their water bill is probably, out of the world. But so as you can see, we need to learn that the bed is a place of sleep and kind of really strengthen that connection. So checking your sleep habits, making sure your bed environment is comfortable. If you drink caffeinated drinks like coffee or energy drinks, caffeine stays in your body for about 6 hours. And so making sure that 6 hours before your desired bedtime, you don't drink any caffeinated drinks. Someone asked about alcohol before. So alcohol acts as a depressant at the beginning when you start drinking it. So what happens is if you drink alcohol, it can help you fall asleep. But what happens through the course of the night is it actually starts to suppress your sleep. And so you don't get good quality sleep and you don't go into the deeper stages of sleep that really make you feel well rested. And so you really don't want to drink alcohol. It can help you fall asleep, but it doesn't really help with anything else. Avoiding naps, avoiding vigorous exercise, avoiding media exposure before bed. If you're a smoker, research shows that, I know that people say the last cigarette before bed is the most delicious, but it really does not help your sleep. Yes, sir? So that's not good. That's actually a counterproductive way to fall asleep. We usually recommend 3 hours. So try to end your vigorous exercise 3 hours before bed. Things like stretching or yoga are usually pretty okay because they help you relax. But what vigorous exercise does is it kind of amps you up and it doesn't get you into the right space to fall asleep. Also reducing time spent in bed. So a lot of people think that actually sleeping a lot is the best, but in sleep quality is much more important than sleep quantity. So what you'll find is that people who don't sleep very well kind of sleep in fragments like this. They'll like wake and sleep, but they'll spend a lot of time in bed. And what you really want is to kind of compress that. So you want to have more consolidated sleep and good quality sleep as opposed to kind of having long sleep. And so one way to do that is to kind of think about it in two types of metrics. You can have time spent in bed and time that you actually sleep. So those two numbers are usually not the same for people. The time that you actually spent in bed compared to the time that you actually sleep. And so to give you an example, it's a metric called sleep efficiency. So let's say you went to bed at 10, you scrolled for an hour, you fell asleep at 12, you went to the bathroom at 1, fell back asleep at 3, woke up at 6, and got out of your bed at 7. So you're in bed for about 9 hours, but you're actually only sleeping 6 hours. And if you do that, if you look at this is just to help me calculate things better. Your sleep efficiency is only 67%. And we want that number to be a little bit over 85%. So if your sleep is if you think about your sleep for the past week, if your sleep efficiency is about 85 to 95%, that's usually the best. If it's too high, like 98, 99%, it usually means that you're sleep deprived, like you're immediately falling asleep when you get into bed, and you probably need a little bit more sleep. A lot of the people that I see in my private practice are individuals who restrict their time in bed and probably have sleep efficiencies that are really low. So they're spending a lot of time in bed, but they're only sleeping a little bit. So you should think about your time allowed in bed as the total sleep time and only add 30 minutes to that. So that's actually a thing, and spend at least 6 hours in bed. Wake up at the same time every day. So strengthening sleep and wake cues is really one of the pillars of getting good sleep. So eating breakfast, even though you don't want to, waking up at the same time, not having a lot of variability during your weekends and weekdays, getting enough light. And I don't know if any of you, I just moved back from California this past year, and I am really suffering from sunlight loss, but it is really important to get a lot of sunlight. So getting more than 75,000 lux a day. So on a rainy day like this, you'll probably have about 5,000 lux, which is not super good, but it's better than nothing. Usually these lights are not enough to kind of get you to regulate your sleep better. So try to get enough light. and relearning to sleep. So only going to bed when you're sleepy, but not tired. Do you know the difference between that? Anyone thought about that? So what is being sleepy versus tired? So sleepy is like kind of when you're dozing off, your eyelids become tired, you feel like you're nodding off. And if you lie down, you feel you can go to sleep pretty easily. Whereas if you're tired, you kind of don't have any mental energy, but you feel like you don't really want to move. And if you lie down, you're kind of tired but wired. I don't know if you've heard of that expression. Your mind is racing and you can't really fall asleep too easily. So usually people don't differentiate the two concepts, but it's very important to go to bed when you're sleepy and not when you're tired. Yes. Okay, let's see. And let's see, don't nap. Napping is bad. Okay, so just closing, I talked a little bit about different types of sleep problems, how we live in a society that doesn't really value sleep. I spent the last year in California at Stanford for my sabbatical. This is my advisor, and she is married to a guy who was the VP, who I think he retired, but he was the VP of Google. And one of the things that they really worked on was kind of building a really healthy culture in Silicon Valley, which I really respected. And one of the things that they really did was kind of having a good sleep culture within Silicon Valley. So if you go to Facebook or Google, you have all these nap pods or places where the employees can sleep and rest. And so I thought, kind of how can we really build a good culture where society values sleep and society values rest, and people don't want to kill themselves. And I also wanted to leave you with kind of how it's an important time for sleep research. Recently in 2017, sleep researchers did get the Nobel Prize. So I thought I just wanted to say that. If any of you use a Galaxy Watch, I don't, but one of the things we did was we paired with Samsung and we made a sleep coaching program, and this is available in English. So if you have a Samsung watch, you should have a Samsung Health application on your phone, and you can use it, and you can pair it with your watch. And that's all I had for today. Thank you very much. Sorry.
Thank you. Any last question?
So
Sure.
I'm curious because a lot of the reasons that Koreans wouldn't sleep in particular is competitiveness, like trying to study more and everything. You probably know the expression, sleep 3 hours, you have a chance to enter the sky.
Yeah.
So I'm curious, has there been any research that you're aware of that would show that there's a basis to that? Like, are people who made it into Sky universities people who slept less? Or like, what about executives at companies? Is it actually like doing the opposite if you get that little sleep?
Well, I mean, there hasn't been studies that have just looked at Sky students and see like asked how much they sleep, which would be a fantastic study, although I don't think they would have time to participate in any research. But research shows that sleeping like that is completely counterintuitive. It's not really healthy for the mind and body, and it's not sustainable over the long term. Actually, CEOs like Arianna Huffington from the Huffington Post, she's one of the people that really promotes really good sleep. And I think a lot of CEOs have tried to build that kind of culture as well. So hopefully it is kind of a start. Yes, sir. Sorry. Yes, sir. Yeah.
What would the sleeping
Well, I don't know about 35 years ago, but like I talked about Edison at the beginning. We call him a sleep enemy because before the light bulb was invented, no one was able to stay awake at night. Once the sun went down, you just have to fall asleep because there's no way you can have any type of activity at night. And so before then, people were sleeping a lot more. There was a lot less competitiveness. Things were a lot more simpler. But unfortunately, it's changing. If you kind of look at how sleep has really changed over the years, every year people sleep less and less and less, which is really unfortunate. Yes, sir.
Do you notice, have you seen a correlation between insomnia and attention deficit disorder?
Yes. So a lot of people with ADHD, attention deficit hyperactivity disorder, do have a lot of sleep issues. And that is partially because a lot of these people are also anxious. So it is a little bit of an anxiety issue, but also a little bit of kind of like not being able to organize their day and making sure that they have enough time for sleep. So there's a lot of multiple issues that are going on with ADHD and those symptoms.
I'm afraid we need to bring it to a
Sure,
close.
sure.
Thank you so much.
No, thank you so much. I am
Sharon.
also